Bringing your blood pressure down is genuinely one of the most powerful things you can do to protect yourself from the two conditions that end up claiming more lives across the developed world than almost anything else: heart attacks and strokes. And it's a far bigger lever than most people realize. If you've spent years believing that managing your blood pressure simply means giving up salt and resigning yourself to bland, flavorless meals for the rest of your life, I want you to set that idea aside for a moment, because it really isn't the whole picture. For the majority of people, sodium isn't actually the primary force driving their numbers upward. I know that might sound like a strange thing to say, since we've all heard the salt warnings for decades. But stay with me, because what I'm about to walk you through could genuinely reshape how you think about your own blood pressure. And by the end, I'll have shared with you 14 practical, research-backed approaches that actually make a measurable difference. Some you can put into practice before the day is even over, and others that might catch you off guard because they have nothing to do with food at all. I've spent years working in acute and emergency medicine, and over that time I've come to notice the same patterns surfacing again and again. The same conditions, the same complications, the same missed windows where something could have been done earlier. And what's become clear to me is that high blood pressure remains one of the most misunderstood issues in medicine today. That matters enormously because cardiovascular disease is still the leading killer in the Western world, and elevated blood pressure sits right at the center of that. I see it constantly in the patients who come through our doors. The reason it's so misunderstood isn't because the science is unclear. It's because the guidance handed to ordinary people has been flattened down until it barely means anything. I brought this subject up with my own relatives, only to hear them respond, "But I barely touch salt," as if that alone settles the matter. So I want to pass along what years of clinical experience have taught me. The actual physiological mechanisms at play, the kind of detail your regular doctor likely doesn't have the time, or frankly the training, to walk you through, because this material isn't emphasized in medical education. Physicians are trained to prescribe, not necessarily to explain the deeper biology. Before we get into the 14 strategies, it helps to properly set the scene, because this isn't just a checklist. It's about understanding what blood pressure actually represents and why the standard advice has let so many people down. In simple terms, blood pressure is the force your circulating blood exerts against the walls of your arteries with every heartbeat. It's expressed as two numbers: the systolic figure, representing the pressure at the moment your heart contracts, and the diastolic figure, representing the pressure during the brief pause between beats. A commonly cited normal is around 120/80, though there's ongoing debate about whether even lower ranges serve long-term health better. The trouble begins when your numbers sit persistently above roughly 130/80. At that point, your heart is forced to work harder with every pump, your arteries gradually stiffen and lose their natural elasticity, and over time this sets the stage for heart disease, stroke, and kidney failure. In acute care settings, I encounter the downstream consequences of this almost daily: strokes that rob people of speech or movement, heart attacks striking people who felt completely fine right up until the moment it happened, kidneys failing to the point of requiring dialysis. What makes it especially difficult to witness is how preventable so much of it actually is, and how often I'm now seeing it in people who are far younger than you'd expect. This is where the conventional wisdom starts to unravel. For generations, the dominant message has been that dietary salt is the chief villain behind hypertension. Cut your sodium, and your numbers will fall. There's a kernel of truth in that for certain individuals, but for most people, salt simply isn't the dominant factor. Large population studies have repeatedly shown that the relationship between sodium and blood pressure is far messier and far less dramatic than we've been told. One long-running study tracking several thousand participants over roughly 2 decades found that those consuming the least sodium actually experienced higher cardiovascular mortality than those eating moderate amounts. That's not a license to salt everything liberally, but it is a signal that we need to stop treating sodium as the single villain and start looking at the fuller picture, because blood pressure isn't governed by one nutrient or one dietary habit. It's shaped by how well your metabolism functions, how healthy your blood vessel lining is, how balanced your nervous system is, and how your daily rhythms, Eating, moving, sleeping, all interact with one another. What follows are 14 evidence-based approaches that target these underlying mechanisms directly. Some will feel familiar, like exercise and cutting back on alcohol. Others might genuinely surprise you. The timing of your coffee or the pace of your breathing. Each one works through a distinct physiological pathway, and each is grounded in real research. This isn't an exhaustive list of everything that influences blood pressure, but it represents the patterns I've seen repeat most consistently. Practical changes that are realistic to adopt and that reliably move the needle. The first strategy is one that rarely gets the attention it deserves: increasing your intake of flavonoid-rich foods. These are plant compounds found in dark chocolate, berries, tea, and certain fruits like citrus and apples, and they have a remarkable capacity to improve endothelial function, essentially how well the inner lining of your blood vessels performs. That lining isn't a passive tube. It's an active tissue that produces nitric oxide, a molecule that signals blood vessels to relax and widen. When it's functioning well, your vessels stay supple and your blood pressure stays lower. When it's compromised through aging, insulin resistance, inflammation, or oxidative stress, vessels stiffen and pressure creeps upward. Flavonoids counter this by reducing oxidative damage, supporting the enzyme responsible for nitric oxide production and calming vascular inflammation. Research pooling numerous clinical trials has found that cocoa flavonoids specifically can lower systolic pressure by a few points and diastolic pressure modestly as well, a small shift on an individual level, but one that could prevent enormous numbers of cardiovascular events across the population. Interestingly, the effect tends to be strongest in people who start with higher blood pressure to begin with, since they typically have more compromised vascular function and therefore more room for improvement. The takeaway is simple: build genuinely dark chocolate, not the sugar-laden kind, along with a rotating variety of berries and regular tea into your routine, and stick with it consistently rather than occasionally. Second on the list is a nutrient I see people falling short on constantly: magnesium. It's involved in hundreds of enzymatic processes, and one of its key roles is regulating the tone of the smooth muscle lining your blood vessels. Without enough of it, vessels constrict more readily, pushing pressure upward. Magnesium essentially acts as nature's calcium channel blocker, counterbalancing the constricting effects of calcium in vascular tissue. Functioning much like certain prescription blood pressure medications, except it's a nutrient your body already needs for countless other jobs. Deficiency is remarkably common. Some estimates suggest close to half of adults fall short of recommended intake, and standard blood tests often miss it entirely, since most magnesium is stored in bone and tissue rather than circulating in the bloodstream. Clinical trials pooling over 1,000 participants have found that supplementation can meaningfully lower both systolic and diastolic pressure, again with the strongest benefit in those most deficient to start. Magnesium shortfalls are also tied to insulin resistance, which we'll return to later, since impaired insulin signaling itself drives blood pressure upward through several pathways. Good dietary sources include leafy greens, pumpkin seeds, almonds, legumes, and dark chocolate, and for those with higher needs, a well-absorbed supplemental form taken in a moderate daily dose can help close the gap. Third is something that surprises a lot of people, because it's not about whether you drink coffee, it's about when. So many patients are told to eliminate caffeine entirely, and they're miserable about it because they genuinely enjoy their morning cup. The truth is that for most people, caffeine itself isn't the villain. Late consumption is. Your blood pressure naturally follows a daily rhythm, dropping 10 to 20% overnight in a pattern called nocturnal dipping, which gives your cardiovascular system essential recovery time. People who lose this dip, known as non-dippers, face significantly elevated cardiovascular risk, even when their daytime readings look perfectly normal. Research using continuous blood pressure monitoring has shown that caffeine consumed even 6 hours before bedtime disrupts sleep architecture and keeps nighttime pressure elevated, often without the person even noticing a difference subjectively. Caffeine blocks the receptors that normally promote drowsiness, ramps up your stress response nervous system, and lingers in your bloodstream for 5 to 6 hours or more. The practical fix isn't to quit coffee. It's to set an early cutoff, ideally by early to mid-afternoon, so your body has time to clear it before you wind down for the night. The fourth strategy is cutting back on prolonged sitting, and this matters even for people who exercise diligently. I've seen this repeatedly. People who train every morning, eat reasonably well, maintain a healthy weight, and still can't get their blood pressure under control. Dig into their day, and you'll often find 8 to 10 hours of near-continuous sitting. Extended immobility reduces blood flow through the arteries, particularly in the legs, which lowers the frictional force of blood moving against vessel walls, a force that actually stimulates nitric oxide production. Remove that stimulus, and vascular tone rises along with blood pressure. Research comparing prolonged, uninterrupted sitting against sitting broken up by brief 2-minute walks every 20 minutes or so found that continuous sitting caused a steady climb in blood pressure, while the interrupted group stayed stable throughout. Even a single hour of evening exercise doesn't fully offset 8 hours of stillness. The fix requires no equipment, just standing, stretching, or walking for a couple of minutes every half hour meaningfully improves insulin sensitivity and vascular function in ways a single workout can't replicate. Fifth is aligning your eating schedule with your body's natural rhythms, specifically eating earlier in the day rather than late into the evening. Insulin sensitivity naturally follows a circadian pattern, peaking in the morning and declining as the day progresses, meaning the identical meal produces a smaller insulin spike at breakfast than it would at dinner. This matters because elevated evening insulin suppresses that crucial nocturnal blood pressure dip. In one notable trial, men with metabolic syndrome eating within an early 6-hour window saw significant blood pressure reductions after just 5 weeks, despite no change in body weight, while a comparison group eating across a typical 12-hour span saw no improvement. Ambulatory monitoring revealed the early eating group had restored their normal nighttime dip, while the late eating group stayed elevated through the night. You don't need to finish eating by mid-afternoon to benefit. Closing your kitchen by early evening and allowing a 12 to 14-hour overnight fast before breakfast captures much of this benefit. Sixth, and remarkably simple, walking, especially after meals. Regular walking consistently lowers blood pressure across dozens of trials, and walking right after eating adds extra metabolic benefit. It increases blood flow and the beneficial shear stress on vessel walls, shifts the nervous system toward its calming parasympathetic mode, and helps muscles absorb glucose without demanding as much insulin. One study found that 3 15-minute walks after meals controlled blood sugar better than a single 45-minute walk done elsewhere in the day, even with identical total exercise time. Since elevated insulin promotes sodium retention, raises sympathetic activity, and stiffens arteries over time, blunting that post-meal insulin spike through a short walk pays dividends for blood pressure with almost no effort required. Seventh is strength training, often overlooked in blood pressure conversations. There's a lingering myth that lifting weights is risky for people with elevated pressure, but the evidence says otherwise. Building and maintaining muscle improves your body's capacity to clear glucose from the bloodstream, since skeletal muscle is the primary site where glucose gets disposed of. Lose muscle mass through aging or inactivity, and your pancreas has to produce more insulin to manage the same glucose load, driving blood pressure up through the mechanisms we've already covered. A large analysis pooling dozens of trials and thousands of participants found that resistance training meaningfully lowered both systolic and diastolic pressure, independent of any weight change. 2 to 3 sessions a week targeting major muscle groups is enough. You don't need to become a competitive lifter. Beyond the metabolic benefit, resistance training also lowers resting sympathetic nervous system activity over time, even though blood pressure temporarily rises during the workout itself, which is entirely normal. Eighth, and this is where the simplistic salt narrative really starts to fall apart, ultra-processed foods. Even when sodium content is carefully matched, these foods raise blood pressure through entirely separate pathways. Packaged snacks, sugary drinks, processed meats, and similar products are engineered to be intensely palatable, are typically loaded with refined carbohydrates and industrial seed oils, and are consumed quickly with minimal chewing, a combination that fuels inflammation, oxidative stress, and insulin resistance. Controlled feeding studies have shown people spontaneously eat more calories and show markers of increased inflammation on ultra-processed diets compared to whole food diets matched for sodium and macronutrients. Large cohort studies tracking thousands of adults over years have found higher rates of new hypertension among heavy consumers of these foods, even after adjusting for sodium and body weight. The fix isn't perfection. It's building meals primarily around whole or minimally processed foods and treating packaged products as the occasional exception. Ninth, and perhaps the most underappreciated driver of all, poor insulin sensitivity. Someone can have entirely normal fasting glucose on a standard blood test and still be significantly insulin resistant, with chronically elevated insulin quietly pushing their blood pressure upward. Elevated insulin causes the kidneys to retain sodium, activates the stress response nervous system, and over time promotes structural stiffening of the arteries. Research has shown insulin resistance often precedes the diagnosis of hypertension by years, and that improving insulin sensitivity can lower blood pressure even without weight loss. Since routine testing rarely measures insulin directly, this issue frequently goes unnoticed, hiding behind indirect clues like elevated triglycerides, low HDL cholesterol, or fatty liver. Nearly every strategy already discussed, earlier eating, walking after meals, resistance training, adequate magnesium, reducing processed foods, works partly by improving this same underlying insulin sensitivity. 10th is moderating alcohol intake. Even modest, socially normal drinking has measurable effects on blood pressure. Acutely, alcohol raises cortisol and activates the stress response nervous system, and it reliably disrupts sleep architecture even when someone feels they slept fine. Analyses pooling tens of thousands of participants have found a clear dose-response relationship, each additional standard drink per day associated with a small but real rise in systolic pressure. Encouragingly, the benefit of cutting back is also dose-dependent. You don't need to quit entirely to see improvement. Scaling down from several drinks a day to one produces a meaningful effect. A reasonable target for many people is capping intake at roughly 1 drink daily for women and 2 for men, with several alcohol-free days each week. 11th is restoring that healthy nighttime dip in blood pressure directly. As mentioned, blood pressure should fall 10 to 20% during sleep, and people who lose this pattern, non-dippers, face dramatically elevated risk of heart attack, stroke, and kidney disease, even when their daytime readings appear well controlled. Studies following thousands of participants over many years found non-dippers carry more than double the cardiovascular mortality risk compared to dippers, independent of their average blood pressure. Nearly every cause of non-dipping is modifiable. Late caffeine, late meals, alcohol, poor sleep hygiene, insulin resistance, and undiagnosed sleep apnea. Restoring the dip isn't a separate intervention. It's the cumulative payoff of addressing the factors already covered. And for those serious about their cardiovascular health, a full 24-hour ambulatory monitor can reveal problems invisible to office or home spot checks. 12th is screening for undiagnosed sleep apnea, one of the most overlooked causes of blood pressure that resists standard treatment. I regularly see patients on multiple medications whose pressure remains stubbornly uncontrolled, and when we dig into their history, the signs are all there: loud snoring, witnessed breathing pauses, gasping awakenings, and exhaustion despite a full night in bed. Each obstructive episode triggers a surge of stress hormones as the body responds to a temporary lack of oxygen, spiking blood pressure dramatically during sleep, sometimes to alarming levels, and repeated nightly stress gradually raises baseline pressure even during waking hours. Among people whose hypertension resists multiple medications, the majority turn out to have sleep apnea, yet it remains hugely underdiagnosed. Treatment with a continuous airway pressure device has been shown in multiple trials to meaningfully lower blood pressure, particularly overnight, and for some people it reduces or even eliminates the need for medication altogether. If you have hard-to-control blood pressure alongside snoring, daytime fatigue, morning headaches, or frequent nighttime urination, a sleep study is one of the highest value tests you can pursue. 13th is your gut microbiome, an area of research that's evolved rapidly in recent years. The bacteria populating your digestive tract produce compounds, particularly short-chain fatty acids from fermented dietary fiber, that influence inflammation, hormone signaling, and how your kidneys handle sodium. Animal studies have shown that transplanting gut bacteria from a hypertensive host into a healthy host can raise blood pressure in the recipient, and that supplementing with specific bacterial byproducts can lower it again. Human studies have found associations between a more diverse gut microbiome and lower blood pressure. While we can't yet prescribe specific bacterial strains with confidence, the practical path forward is clear. Prioritize fiber from a wide variety of plants. Since most people fall well short of recommended daily intake, include fermented foods where you enjoy them, and minimize unnecessary antibiotic use, artificial sweeteners, and heavily processed foods that can erode microbial diversity. And the 14th and final strategy is slow, deliberate breathing. Not meditation or any particular spiritual practice, simply the physiological effect of breathing at 4 to 6 breaths per minute, far slower than the typical resting rate. This activates baroreceptors, pressure-sensing structures in your major arteries that help regulate blood pressure moment to moment, and improves their sensitivity, which tends to decline with age and chronic stress. Slow breathing, especially with an extended exhale, also boosts activity in the calming branch of your nervous system, lowering heart rate and vascular resistance. Research pooling well over 1,000 participants found that guided slow breathing lowered systolic pressure by an amount comparable to what you'd see from a single blood pressure medication. Practicing for 10 to 15 minutes daily, breathing slowly through the nose, letting the belly expand fully, extending each exhale, requires no equipment, carries no side effects, and can be woven into a morning or evening routine. None of these 14 approaches needs to be executed flawlessly or simultaneously. They're 14 different doors into the same underlying rooms: vascular health, metabolic balance, nervous system regulation, and circadian rhythm. Salt matters for some people, but it's a small chapter in a much larger story. The most efficient place to start is wherever your biggest gap currently sits. If you're sitting still for 8 hours a day, movement breaks may be your highest leverage change. If your last coffee is at 4 in the afternoon and your sleep is poor, shifting that cutoff earlier likely matters more than perfecting your diet. If most of your meals come from packages, rebuilding around whole foods will move several pathways at once. For most people, the biggest gains tend to come from addressing insulin sensitivity directly. Earlier eating windows, reducing processed foods, walking after meals, and resistance training, layered with the circadian and nervous system strategies of caffeine timing, alcohol moderation, sleep quality, and slow breathing. None of this dismisses medication when it's genuinely needed. For people with very high readings or underlying kidney or genetic factors, medication remains essential. But even then, these strategies often allow for lower doses, fewer side effects, and better long-term cardiovascular outcomes. The goal was never perfection. It's steady, sustainable progress, one habit at a time, building on each small success as it accumulates.